Multiple sclerosis is associated with deficiencies in vitamin D, B12, and vitamin A, but what nutritional supplements are actually proven to be beneficial in the treatment of MS and in MS symptoms? Today, this is an evidence-based video answering this question, and I'll include some references in the notes below and some timestamps if you want to skip ahead. Let's have some fun. I want to give the caveat that I intend this video for informational purposes, and I would strongly suggest you talk to your own provider about your own supplement regimen, as some of these supplements can cause side effects. For instance, high doses of vitamin D can cause elevated calcium and kidney stones, and high doses of vitamin A can also be toxic. I also want to say that I have a very slight conflict of interest here. I am going to be advocating the use of flaxseed oil, which is recommended by Professor George Jelinek in the Holism study, and he and I do have a little bit of a relationship, though it is not financial, and I will reveal it in a later video. By the way, my name is Brandon Beaber, and I make videos about MS every Wednesday, so please subscribe and ring the bell for notifications. Now, the vitamin most strongly associated with MS is vitamin D, and you probably all know that low levels of vitamin D are associated with the risk of MS, and even though we think of it in terms of bone health and calcium metabolism, vitamin D has profound effects on the immune system. For example, it actually binds the gene for the major histocompatibility complex type 2, which is involved in how our immune system interacts with the environment. And if you want more information on vitamin D, I have a separate video on this topic and how it relates to MS. The typical doses recommended for MS are 5 to 10,000 international units of vitamin D3 daily, or 50,000 international units weekly. And in terms of blood testing, the goal level is about 50 to 60 nanograms per milliliter for most doctors in the US. And be aware of the conversion here. A lot of international labs use nanomoles per liter, and the conversion is 2 to 5. So 60 nanograms per milliliter is equal to 150 nanomoles per liter. And just to show a few examples of pieces of evidence suggesting the link between vitamin D and MS, this is a study on clinically isolated syndrome. So these are people who had a single demyelinating event, such as optic neuritis or transverse myelitis, and don't meet the diagnostic criteria for MS, but are at increased risk of MS. And if you look at people who have higher levels of vitamin D, greater than 50 nanomoles per liter, they have a lower risk of getting MS compared to people who have lower levels of vitamin D. Now again, 50 nanomoles per liter is equal to 20 nanograms per milliliter, so we're really looking at vitamin D deficiency. Also, if we look at people who already have MS, people who have higher levels of vitamin D are less likely to get new lesions. So you can see, again, people with greater than 50 nanomoles per liter levels of vitamin D have less new lesions on average. And again, we're really looking at vitamin D deficiency, so vitamin D deficiency is associated with more lesions in MS. Now, it's not so clear that actually taking vitamin D is beneficial. This is from Cochrane's evidence-based reviews, and they looked at 5 different randomized trials for vitamin D supplementation versus placebo, and on average, the odds ratio is 1. In other words, there's no benefit to vitamin D whatsoever. However, these were smaller studies, and a lot of them use lower doses, so it's not so clear. It's possible that vitamin D isn't actually beneficial, but there's confounding with another factor, which is ultraviolet radiation exposure from the sun. And in my personal opinion, the evidence connecting the sun and multiple sclerosis is much stronger than the evidence connecting vitamin D and multiple sclerosis, and I have a separate video on sunlight in MS. Nonetheless, I definitely recommend vitamin D supplementation in MS just in case. The next supplement I want to talk about are omega-3 fatty acid supplements. And in organic chemistry, the term omega-3 just refers to the distance in carbons from the methyl end of the fatty acid side chain. So for instance, this is alpha-linolenic acid, which is present in flaxseed oil. And in the body, this is metabolized into DHA and EPA, which are the biologically active omega-3 fatty acids. And those two fatty acids are enriched in fish oil. And it's thought that in modern times, our diet has an increased ratio of omega-6 to omega-3 fatty acids, and this could play a role in inflammation in human diseases. And it's thought that modern junk oils such as sunflower seed oil and corn oil, which are very rich in omega-6 fatty acids, may be deleterious. So this is an attempt to combat and change that ratio, and there's a lot of research on how omega-3 fatty acids affect the immune system. Just to give one example, it's known that omega-3 fatty acids decrease matrix metalloproteinase 9 levels, which are known to be linked to tissue injury in MS. And the man to the right is Professor George Jelinek, who's the first author of the holism study, and I'm going to show you the data of that study. So this is an epidemiologic study looking for links between lifestyle and disability and attacks in MS. They're looking at smoking and diet and in nutritional supplements. And they looked at whether or not people were taking omega-3 fatty acid supplements, and you can see there's a slight difference in relapse rate between those who are taking them and those who weren't. So if you weren't taking omega-3 fatty acid supplements, the rate of relapses was 0.78 per year versus 0.67 if you were taking them. Only a 14% difference, and it was not statistically significant, p-value 0.085. However, if you looked at overall disease activity, which includes things like MRI scans, they did show a slight statistically significant difference. However, when they specifically looked at the type of the omega-3 fatty acid supplement, they found that flaxseed oil seemed to be much better. So again, relapses per year, 0.78 with no supplements, 0.72 with fish oil, and 0.37 with flaxseed oil. So a 52.6% reduction, which has a p-value less than 0.001, and of course disease activity was also highly statistically significant. So he actually changed his recommendation from fish oil to specifically flaxseed oil. Now, if we look at the dose, it doesn't really seem to make much of a difference. So this is the dose. So people who weren't taking it had a relapse rate of 0.78. 1 to 2 milliliters, which is approximately equivalent to 1 to 10 grams, had a relapse rate of 0.68, and 11 or more, 0.65. So there's not a clear effect on dose. Now, there was actually a randomized study for fish oil in multiple sclerosis using a dose of 10 grams per day, which is quite a high dose, and they used fish oil, which is again DHA and EPA versus placebo. And in the treatment group, 51% had either improved or stable EDSS, and EDSS is a measure of disability in MS, and I have a separate video on it if you want to take a look, whereas 41.4% taking the placebo were stable or improved. So a slight difference, 51% versus 41.4%. So I personally recommend flaxseed oil just based on the holism data, although you could argue that there's an actual randomized trial favoring fish oil, and theoretically, fish oil has the omega-3 fatty acids that are the biologically active forms, so it's effectively more potent. The next supplement I want to talk about is high doses of biotin, which has been purported to be a treatment of progressive multiple sclerosis. Now, it's not exactly clear how biotin could be beneficial in MS, but it's a cofactor in multiple carboxylase enzymes involved in metabolism. And it's thought that part of progressive MS degeneration could be related to metabolic failure, particularly in the function of the mitochondria. So high doses of biotin could potentially overwhelm deficiencies of the mitochondria, improving function in the neurons. Now, I have a separate video on biotin if you want to learn more about it, but just to show one example, this is a study comparing biotin 300 milligrams to historical placebo groups to other agents. And so please make note of the units here. 300 milligrams is an extremely high dose. A typical dose used for hair and nail health is 5 milligrams or 5,000 micrograms. So it's hard to get this dose over the counter, but it could be easily obtained online. You should also note that biotin is thought to be relatively safe, although certain laboratory tests actually use the enzyme biotinidase, so you can actually get a false result if you're taking high doses of biotin. So some examples include thyroid stimulating hormone. That blood test uses biotinidase, which is used to monitor for thyroid disease, along with troponin, which is a blood test used to check for a heart attack. Now, biotin is not thought to cause thyroid disease or heart attacks, but could potentially interfere with these blood tests, so it's important to know about that. So looking at this study, you can see this is biotin 300 milligrams, and we're looking at change in EDSS, a measure of disability in MS, over 2 years. And pretty much those who are taking biotin were stable. And if you kind of compare this to historical control groups, they kind of average out to a change in about 0.35 worsening of the EDSS over 2 years. So it looks like those who are taking biotin did a little bit better, but this isn't a head-to-head trial. It's kind of a comparison to historical controls, so it's not the best evidence. Also, there's some randomized trials with biotin that showed absolutely no benefit whatsoever, so it's not really clear if it actually works. Next, we'll move on to vitamin A. Now, it's not so clear how vitamin A could be directly related to MS, but for whatever reason, people with MS are slightly more likely to be deficient in vitamin A, which has a known function in visual acuity. However, there was one randomized trial which gave people 25,000 international units daily for 6 months, followed by 1,000 international units for 6 more months, and they looked at various things. The only thing where they saw a significant difference was something called the MS functional composite, which is a very detailed measure of disability and function in multiple sclerosis. And those who took the treatment declined by an average of 0.14 versus 0.31 in the placebo. And that was highly statistically significant with a p-value of less than 0.001. However, there were no differences whatsoever in relapses, enhancing lesions, T2 lesion volume, or EDSS, which again is sort of a less sensitive measure of disability change. Now we're going to move on to supplements that don't necessarily have evidence in terms of treating the underlying disease MS, but may have benefits in managing some of the symptoms. So we'll start with neuropathic pain, which is that sort of sharp, burning, stinging, electric, uncomfortable pain that can be associated with neurological diseases like MS. And I have a separate, more detailed video on this topic if you want to take a look. But a couple of the supplements that have been used are alpha-lipoic acid, or ALA, and benfotiamine. Now I have to admit these really haven't been studied well in MS itself. They're mostly studied in painful diabetic neuropathy, but some people anecdotally report that they could be beneficial in other forms of neuropathic pain. So alpha-lipoic acid is usually dosed at 200 to 600 milligrams twice daily, and interestingly, it has some theoretical effects that could be beneficial in MS in general. For instance, ALS is an antioxidant and reduces serum matrix metalloproteinase 9, which I discussed earlier. Benfotiamine, on the other hand, is actually a lipid-soluble form of thiamine which penetrates past the blood-brain barrier, and it was originally developed as a treatment of B1 deficiency causing Wernicke's encephalopathy. However, there's one study on painful diabetic neuropathy, and it seems to have some potential benefit, and it has been used rarely in MS, although it's difficult to obtain. For fatigue, various supplements have been attempted. The most common by far is probably B12, and a typical dose is 1,000 micrograms daily, although it can also be given by subcutaneous or under-the-skin injections. Carnitine, which is involved in fatty acid transportation to the mitochondria, also has been linked to fatigue. I actually saw a poster at a professional conference suggesting that carnitine supplements are not beneficial in MS fatigue, so I only really recommend it to people who actually have a carnitine deficiency based on their laboratory tests. There's actually a randomized trial for MS fatigue on coenzyme Q10, which is a cofactor in mitochondrial metabolism similar to biotin, and a 12-week randomized study showed that 500 milligrams a day is slightly beneficial in MS fatigue. Now, for muscle spasms and spasticity, that sort of tightness and contraction of muscles that can occur in MS, people are often looking for alternatives because some of the pharmaceutical drugs aren't that well tolerated. Baclofen, tizanidine, cyclobenzaprine, sometimes they can cause a lot of sedation and other side effects that people don't like. So some of the alternatives are magnesium supplements. A typical dose would be magnesium oxide, 400 milligrams once or twice daily, and also the amino acid L-threonine, which is actually a precursor to the inhibitory neurotransmitter glycine, which is important in muscle relaxation in the spinal cord, although I can't really find specific evidence for L-threonine in MS spasticity. I'll also mention migraine briefly, even though it's not directly related to MS. About 15 to 20% of people with MS also have migraine, and there are some supplements that have been used to try to prevent it or at least decrease the frequency of migraine attacks. One of them is riboflavin, vitamin B2, at a dose of 300 to 400 milligrams daily, and it typically comes in a 100 milligram tablet, so you would just take 3 or 4 of them all at once a day. And it's very safe. The only known side effect is really that it can cause your urine to become a bright yellow color. And magnesium, as I mentioned earlier, can also be used as a migraine preventative. Now, I don't want you to take all of this as gospel. Obviously, there could be some counter evidence, which I didn't present here. I try to be optimistic and make these supplements look as good as possible. Also, there are many supplements I didn't mention which do deserve their own time. One example would be probiotics, which don't necessarily have specific clinical evidence in MS, although there are studies suggest that they could improve the inflammatory profile in people with MS, and we look forward to future research on this topic. So if you have any questions about the supplements or others that I didn't mention, or if you have suggestions for future videos, please post in the comments below.